So here's a case that arrives to you because it was flagged by a technician because the MCV was very high. And even at 10x, we can see the abnormality here. The main abnormality that we're seeing is the red cells are inappropriately agglutinating. And so you can see that there's tons of white space that's filled by white cells and platelets, and the red cells are all clumped together here. And so we call this red cell agglutination. When we go to higher power, we can see that the red cells have almost entirely lost their central pallor, and it's very difficult to distinguish one red cell from another. Autoagglutination of red cells occurs due to the presence of a cold agglutinin, which is most commonly an IgM antibody. It may occur at any temperature less than 37 degrees Celsius. Cold agglutinins may arise in a variety of disorders, including infections, lymphoproliferative disorders, and plasma cell disorders, or without any identifiable associated cause. Clinical conditions associated with red cell autoagglutination include mycoplasma pneumonia, malignant lymphoma, and cold agglutinin disease. And as far as the red cell indices are concerned, in vitro red cell agglutination causes a false decrease in the automated red cell count and a false increase in the MCH and MCHC and MCV. This in vitro effect can be mitigated by incubating the blood specimen at 37 degrees for 10 to 20 minutes prior to reprocessing for CBC through an automated analyzer. And if we switch and actually incubate this specimen, you can see that the autoagglutination disappears and the red cells aren't forming those dense agglutinations. Agglutination is different than rouleau, and here we'll see an example of rouleau. And so as we move in from our feathered edge to our zone of holes, we can see that the zone of rouleau really comes into focus in our usual area of zonal morphology. And so I'll repeat that. So as we move in one 10x field, we should see our zone of holes, which is effectively gone in this specimen. And we'll go one more 10x field in, and you'll notice that all of the red cells here are stacked up on one another like a stack of coins. And so this is the difference between rouleau and agglutination. And if we go on higher power, we get a better sense of what these red cells look like when they're stacked up on one another. And so these stacks of red cells or stacks of coins are referred to as rouleau. True rouleau is often associated with hyperproteinemia, primarily hyperglobulinemia, and hyperfibrinogenemia. In contrast, artificial rouleau, which is typically seen in the thick area of virtually every smear, is not associated with any disease state. Hyperproteinemia can also cause a sort of blue tinged background. However, we're not able to appreciate that on this smear, primarily due to the fact that this does not project as well via video. Increased amounts of globulins and fibrinogen, which have a net positive charge, bind to the surface of red cells and neutralize their net negative charge. So the red cells, instead of repelling each other like normal, they actually begin to stick together and form primarily rouleau. Occasionally, several rouleau areas will agglutinate together and may form rare foci of red cell agglutination. Clinical conditions associated with red cell rouleau include multiple myeloma, as seen in this case, Waldenstrom macroglobulinemia, which is often caused by a malignant lymphoma, and infections or inflammatory conditions.